Good morning, everyone. Welcome to Friday Friends here with RI Elder Info. I'm Deb Burton, and I'm the founder and creator of RI Elder Info. RIElderInfo.com is the most comprehensive resource available for seniors, caregivers, and professionals in Rhode Island. So if you're looking for any kind of resources, go to RIElderInfo.com and you'll be able to find information on health and support, housing, transportation, legal and financial considerations as we age, government agencies and advocacy, as well as fun things to do as we age. So what we do is not possible without our sponsors. We're really grateful to Oak Street Health, Tamarisk Assisted Living, D&B Media, England Studios. They really make it work for us. We are really blessed to be able to have them. One thing that's really important for you to do as one of our viewers is that you hit the like button and that you share this video, because I'm confident that there are people out there who are going to need or currently need the information that we're going to be discussing today. So today I'm very excited to introduce someone I've known for a while and get to hear more about what she's been up to. Dawn Allen from Thrive Behavioral Health. Welcome, Dawn.
Thank you for having me, Deb.
Thank you. I'm so glad you're able to join us. So please tell our viewers about what it is that you do and Thrive Behavioral Health.
Sure. So I am the project director for the CCBHC, which stands for Certified Community Behavioral Health Clinic at Thrive Behavioral Health. What that is it's a kind of a national push to break down barriers for people to get into mental health services and make treatment more accessible to people. So SAMHSA awarded Thrive a 2-year grant to be able to focus on 10 different evidence-based programs and really focus on what the community needs and put those services in place. So like I said, we're focusing on 10 different programs. They go anywhere from, we have an integrated health home team that focuses on people who have mental illness, but also complex chronic health conditions. And we have a nurse that we were able to hire to really work with those people to bring their mental health and physical health in line together and not just look at them as separate entities. We also have a permanent supportive housing program that helps people throughout our community get into housing or learn how to apply for housing, basically anything that they need for housing, keep their current housing. We have a child's mobile crisis response program. And that's really, it's a crisis program for kids who are having behavioral health issues. It's a place that you can call and a clinician will come out to your home or wherever you want to meet with them and give you referrals for the next level of treatment. We have a peer recovery program for people who are HIV positive. We're actually building a new medication-assisted therapy program out of our Health Lane office, which is right in Warwick, right next to the Kent County Hospital. So we're going to be able to bring MAT to Warwick, which is really needed, anywhere in Rhode Island right now, considering we're also facing an opiate epidemic as well. So we're really excited to be able to do this and kind of think outside the box and not have to really work within the confines of our current payment systems, which is private insurance and Medicaid.
That is a lot of stuff to unpack there. Wow, you guys are doing a lot of work. That's awesome. So when you're talking about having a team that can go into people's homes to help with behavioral health, what does that look like? Like who would call, who would use that? How would someone know, like, oh, this is the situation that I would reach out to Thrive for?
Yeah, so we're really a community-based mental health center. We have the distinction Community Mental Health Center, which through Buddha, allows us to really focus on the community that we're located in. So there's 9 community mental health centers now. I might be wrong on that because some of them have merged, but and each of us really focus on the community that we're in. So for Thrive, we focus on Kent County, although we will serve anybody that comes to us. We're not constricted in who we can serve. But in that community, we have kind of different levels of treatment and people that could go out into the community and meet with you. So especially during the pandemic, when people are having feelings that they never had before and might be questioning, like, is this something I should reach for help? You can call our emergency services line. We will serve anybody through that line. You don't have to be a current client. And that number is available 24 hours a day, 7 days a week.
What is that number?
That number is, I should know it off the top of my head, but.
Yeah, but you probably don't call yourself too often.
I don't call it myself. And I did have it right in front of me.
Here we go. 401-738-4300.
Thank you.
That is the magic that happens behind the scenes.
Oh, thank you so much. Yeah. I don't know where that went.
So if someone is, say, maybe having a problem with a substance use disorder, maybe overusing opioids, that kind of thing, is there help available?
Yes, definitely. Yeah, we actually have clinicians that are able to respond in person until midnight, 7 days a week. So if the situation warrants somebody to come out to the home or maybe at a business or something like that, we can send people out. We also, like I said, we're available 24 hours. So we have phone access. We partner with a lot of other agencies like BH Link, which is in-person 24 hours. So if we're not able to come out to you because of the hours, we can help facilitate you to get up to BH Link, where they can also kind of do the same thing we would, which would, give you an assessment, decide what the next level of care would be for you, and then kind of put that in place for you. So there is a lot of help out there now, which hadn't always been there like a decade ago.
Yeah, things were much different 10 years ago. When you're talking about mental health, do you feel like there's still stigma around that?
There definitely is. I think it's become better. And I think that's because we've done a better job of educating the public around what mental illness is and substance use disorder. And we've really educated people that these are illnesses and they're not something that you can just get over or, overcome with willpower. I think the public's starting to understand that now. Especially with substance use disorder. I mean, there's been such negative stigma out there about that. And I think people are just through this epidemic, are just understanding that maybe this isn't something you can just stop.
Yeah. It's interesting. There's a big campaign. I see it on TV. I've seen it on social media. It's okay to not be okay. I think it might be important for people to talk about when they do struggle. Before this, I was watching the Today Show, and Carson Daly was talking about how he himself struggles with anxiety and panic attacks. And I thought, it's good that it's on a national platform that people talk about that. I feel like a lot of times we just kind of laugh it off as like, oh, everybody has anxiety and depression. Everybody's got it. It's no big deal. But it really kind of is. And at what point do you seek treatment?
Yeah. And what people don't understand is that anxiety and depression could really ruin your life if you don't get help. If you just have like the thought that you just said, like, oh, everybody has this, I can overcome this myself. And if it continues to get worse and you don't have the coping skills to deal with those symptoms, I mean, I've seen people's lives torn apart from anxiety and depression.
What can they look like? Because I think sometimes we think of anxiety as someone like, and like curled up in a ball and they can't move. And, depression is like, I'm, Eeyore and I'm under the covers. But what else can they look like?
Yeah, I mean, they can definitely look like that. But I mean, just somebody walking down the street that appears fine could be dealing with severe anxiety and depression. The difficult thing with mental illness is people a lot of times try to hide it. So they try to make it look like they're functioning fine where inside they're completely falling apart.
Yeah, yeah. I think, one of the things that we learned during COVID is sometimes our depression and anxiety looks like a second glass of wine. It can look like, let me make an entire batch of cookies and eat them by myself.
Mm.
It's things like that that sometimes we don't always acknowledge is a coping mechanism that's not in our best health interest. Um, it's things like that that we don't often think maybe I should talk to someone. We also see this sometimes with caregivers.
Mhm.
And can you speak about the program that goes into the house to help people who have complicated health issues?
Yeah, sure. Yeah, so before the CCBHC, we had integrated health home teams and assertive community treatment. And it's both a team approach to people who have mental illness, and they largely work in the community with people. So they are going into people's homes. They're helping people put kind of everyday necessities in place, helping people with grocery shopping, laundry, cooking meals, taking their medication, learning more about their mental illness and their medication and different symptoms, and learning coping skills and things of that nature. So when the pandemic hit, we couldn't just stop doing that. I mean, these are people that really, really need our help. So our staff have still been going into people's homes and greatly putting themselves at risk. And they're kind of the heroes of the pandemic, really, because they haven't really thought twice about it. They just know there's somebody out there that needs their help, and they've just been continuing to do that. And then our CCBHC complex care health home, kind of our funds are largely come from Medicaid, and Medicaid doesn't really allow us to do the things that we really, really need to do, which is look at somebody who maybe doesn't have insurance or is underinsured, and is suffering with a chronic health condition, but also is suffering from mental illness or substance use disorder. And they kind of both go hand in hand, and you really need to serve them together. So that's kind of what this team does, and what our nurse is doing is looking at both physical health and mental health, and seeing how the two are interacting and how the two need to be treated together, and then also providing education and support services. So we have one of those that's located right at Thrive. And one thing I didn't mention is our CCBHC, we've partnered with 3 other agencies. So Community Care Alliance, which is located up in Woonsocket, also has a complex care IHH team that's doing similar things to what we are doing. And then we've also partnered with Tides Family Services, who's running our Children's Mobile Crisis Response Program, and Kodak Behavioral Health, who's going to be running our MAT program in Warwick.
And those partners, those are all outpatient partners, correct?
Correct. Yeah.
Yes. And so the inpatient, if somebody needed inpatient emergency treatment, that would be BH Link.
Yes. Yeah.
Okay.
BH Link is actually one of our partners too.
Okay.
So yeah, we work very closely with them.
And Stephanie from BH has said hi.
Hi, Stephanie.
It's, there's so many different pieces. If, for our seniors, one of the things that used to be pretty common is that if you acknowledge that you had a mental health condition or were found to have an addiction issue, back in the day, not that long ago, but 60s and earlier, give or take, you would be taken to the Institute for Mental Health, IMH, over in Cranston, dropped off, and you wouldn't get out. You wouldn't come home. That would be that. So I think, having the ability to receive the treatment in your home and not ever have to leave your home, I think that could be very helpful for our seniors. Some of them also face real challenges, mobility challenges, that kind of thing, to be able to get out of the house to get the help that they need. Do you offer telehealth at all, telemental health?
We do, yeah. And during the pandemic, it's been extremely beneficial for us because it's a risk having all of our clients in the office. I mean, we've even limited the amount of staff that can come in the office. So having telehealth and allowing people to continue with their appointments has really, really benefited everyone. And we've also found too that our clients are really enjoying telehealth. I mean, it's not for everybody. There's still clients that, want that face-to-face, and we are allowed, we are able to do that. But in large part, we've seen our appointment rates increase where people are showing up for their appointments. And I think a lot of it has to do with too, the ease at what telehealth is, I mean, you can sit on your couch and just turn the computer on and just be able to speak with your therapist. You don't have to find transportation and childcare, and, you could be making dinner while you're speaking with your therapist if you want. So that it's really kind of an easy way to engage. And two, it kind of cuts down the stigma of, having to walk into our office, where we had talked a little bit about that. It's getting better, but I mean, it's especially the older generation still have it in their head that they don't want to reach out for help because they can do this themselves. And, they might not want to be seen walking into our office. So being able to just speak with a therapist from their own home is, could be also a way to get new people who really need us into the virtual office.
Yeah, that would be great. And most of the time, my viewers are older adults, their caregivers, or the professionals who service them. But you mentioned something earlier on that I think is really important that people be aware of, an additional service that you also have a crisis team for children.
Yeah.
So how does that work? Because I know that that's a population that really is underserved.
Yeah. And so a lot of people have the misconception of what a community mental health center is, but at Thrive, we're really a one-stop shop where you can come in with your children. Your children can get therapy from our Child and Family Services program, and then you can get therapy from our adult program. And then through the CCBHC, we were able to partner with Tides Family Services and create this Children's Mobile Crisis Response Program, where if you do have a child that you're just don't know what to do, or it's a crisis situation, you can call our Thrive's emergency services line, and we'll connect you with this program, who within 24 hours, they'll send a clinician out to your house to kind of assess the child, the whole family, kind of see what services are needed to be in place. And then they'll put those services in place for you and kind of give a warm handoff to the next level of care. They do respond to KidsLink too, so you could also call KidsLink. They get a lot of referrals from the hospitals, Bradley, Hasbro, a number of different schools are aware of them. So really anybody could call them even if you have questions about what to do.
That's amazing, because that's definitely something that's been identified as a needed service. So I'm really glad to hear that you guys do this. So real quick, what made you find this line of work? What drew you into this?
Yeah, so for 15 years, I worked with adults who had mental illness and were criminally involved. So I worked inside the ACI. I was also a social worker for the Public Defender's Office. And then I went for about 2 years and worked for the Executive Office of Health and Human Services, where I met you. And I ran the Medicare Medicaid program. So it was a lot more higher level policy work. And it was difficult to really see the results of the work that you were doing. And I really was missing behavioral health. So I had seen a job posted through the State Opioid Response Grant at Thrive Behavioral Health. And it was really, working in the community, talking to people about substance use disorder, seeing how different agencies can work better together, building collaborations. And so I thought it was right up my line of work. So that's where I started with Thrive, was as a community liaison on the State Opioid Response Grant, which really was a great move for me because I got to meet so many different people and become part of a number of different groups that were really doing advocacy and things of that nature. And then when we received the CCBHC grant, I thought that would be another great move to be able to kind of mold something from nothing and, have the funds to be able to really look at the community, see what's needed, be able to start breaking down barriers for people to get into treatment, produce high quality care, and really build something great.
That's awesome. And I love the breaking down the barriers and high quality. That's all, what RI Elder Info is all about too. So if somebody, is Thrive Behavioral Health a nonprofit?
We are.
And if somebody wanted to help, they wanted to make a donation, how could they do that? Or do you take volunteers? What kind of services, what kind of things can our viewers do to help?
Yeah, they can always go to our website, thrivebhri.org. And we have a donate button on there. They can learn more about us. If they want to, if they're interested in volunteering, I'm sure we'll talk to them. Our main number is right on there, which is 691-6000. See, I know that one. But yeah, we love taking donations. People, especially during the pandemic, people have been very generous to us, people and businesses. So we're really happy that, people are seeing the good work that we do and wanting to support us.
That's amazing. That's awesome. Any final thoughts?
Yeah, I mean, anybody listening, if you're questioning if you should get into treatment, or you have a friend and you're like, I kind of think they should talk to somebody, give us a call. We'll be able to talk you through it, let you know what we recommend. If it's not us that you want to receive treatment from, I mean, we are aware of plenty of other places that could help too, that we can let you know about. So don't hesitate to give a call. It doesn't hurt to reach out.
Oh, and I apologize. I have one more question.
No.
Do you offer for individuals who participate ordinarily in AA, NA, Al-Anon type meetings? Does your office still offer those through the COVID situation?
So we don't have AA or NA groups at our office, but we do have an outpatient substance use disorder treatment that people can get through our office.
And I'm sure that you'll be able to connect people with those services if necessary.
Yeah, definitely.
Yeah. Dawn, this has been great today. I really appreciate you coming on and sharing more about Thrive and the ways that you're able to help the folks in the community. I think now in the age of COVID and we've got the pandemic stress, we've got the insanity that happened last week. I think that a lot of people, they're running on fumes and they really could use some help. So I appreciate you really coming on and getting the word out today. This has been great.
Yeah, thank you so much for having me.
Awesome. Thank you. Thank you, everybody, for coming today. I really appreciate it. Make sure that you hit the like button and that you shared this out. As I'm sure you're all aware, these are unprecedented times, and there's a lot of folks out there who need help and really could benefit from seeing this video. So please share it. I look forward to all of you joining me next week. Also, quick shout out. If you are a caregiver and you are looking for support, RI Elder Info is now offering caregiver support groups on the third Friday of the month at 10 a.m. You can always just reach out to me, Deb at rielderinfo.com. I wish you all well, and I look forward to seeing you all next week. Thank you.
If you liked this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb at rielderinfo.com.